Good afternoon, everybody. Thank you for joining us for today's webinar, The Incredible Journey of Child Welfare Transformation. I'm Meg Dygert, Senior Policy Associate for APHSA's portfolio of child and family well-being work, including working with our National Association of Public Child Welfare Administrators, otherwise known as NAPWA. APHSA is a state and local APHSA represents state and local health and human services agencies through their top-level leadership. We seek to influence modern policies and practice, help our members build capacity for their teams, and connect them to other human services serving organizations and policymakers. To deliver value to our members, we aim to influence modern policies and practice that support the health and well-being of all children and families, that lead to stronger communities, build more capacity through the access of our professional education and development conferences, technical expertise, publications, and organizational effectiveness practice. And finally, connect members to national policymakers and human servicing organizations across a wide circle of stakeholders in the health and human services sector, as well as key partners in education, housing, employment, and other sectors. And speaking of those educational conferences, our summit registration is live, I believe, as of earlier this week. So we would love for you to join us in Baltimore this year for our National Human Services Summit. This year's theme is co-creating the future of human services. And we have just released or about to release the agenda at a glance, and the content looks great today looks great this year. And I'm very excited. So I hope you can join us. And with that, I am honored to turn it over to today's speakers to start today's presentation. Danielle?
Well, good afternoon, everyone. It is a pleasure to be with you all today. I am excited about the panel that you're going to hear from today. And what we thought we would do is break it up and just have a bit of a conversation with you all today. So joining me today, we have Andrea Daines, who is our EY. I say she is our global human services lead and pretty much the mother of all human services strategy for Ernst & Young. We are also joined by Dr. Deborah Shropshire, who is an executive director of the Oklahoma Department of Human Services. And when I tell you this woman's background is amazing, I think you're going to be equally as blown away by hearing a bit about her journey and some of the things that are happening in the state of Oklahoma. So with that, I just kind of want to kick us off a little bit about myself so that we can talk a bit about how we got here and why we're talking about the transformation of child welfare. So I serve as the US lead for human services inside of Ernst & Young, and I've been with the firm just a little over 2 years. Prior to joining Ernst & Young, I served as the commissioner for the Tennessee Department of Human Services. I always tell people I'm a recovering lawyer, so don't hold that against me. But what I tell people, and I think those of you that are on the call today can relate to this, is I had hit that point in private practice where you either have to become partner or you have to figure out what's next. And so I was, as their legislative person, went to hang out at the Department of Human Services. I thought I was going to be there for one legislative session for 4 months, and absolutely fell in love with the mission and seeing it in action every day and helping over 2 million Tennesseans. And so that is what led me to a 16+ year career inside of the Tennessee Department of Human Services and other state agencies. And I have to tell you, I tried to leave multiple times to return to my my practice of law, and I kept getting drawn back. And because I think that just exemplifies a bit of the passion that we all have for this work, for making families stronger. That's my journey. And I just think that it's really important, before we really get into the depth of the conversation today about child welfare, that you hear from our panelists about their journey. So Dr. Deb, I'm going to start with you because you too have a recovering practice and you ended up in the government sector as well.
Yeah, I did. I actually wound up kind of in my specialty because of the government. I am a pediatrician, recovering pediatrician, who was actually going to go in a different direction in medicine. I was in medical school and ran across the child welfare system, ran across, kids who were coming into a children's hospital because of child maltreatment. And in the process of learning about that, had several encounters with the court, with caseworkers, with providers, with parents, with foster parents. And that whole experience completely broke me, kind of disturbed me. And I wanted to spend my life trying to figure out how to serve the people who are trying to serve kids and families in that space. And so I wound up in pediatrics, and then along the way kind of came alongside the Department of Human Services and our child welfare agency. And then over time, infiltrated and had the opportunity to step in and serve as a deputy director for community partnerships for child welfare, helping the community figure out how to interface with government, and really enjoyed that season. And then into the child welfare director role, where I served from 2019 to 2020 to actually till January of this year, and then have had the opportunity to now step into the leadership role for our entire agency. So a non-traditional pediatrician career track. And on the other hand, every single step of the way has, I think, I've learned a ton about what families need and how to figure out how to work between government and communities to try to meet those needs.
Love that. And thank you for your service. I can always say that never gets said enough. Andrea, you have a personal connection to what we're talking about today, and your path has been a little bit of government, a little bit of private sector, a little bit of policy, and a little bit of tech. So all of that is, I think, going to be very critical to what we're talking about today. Tell us about your journey.
Absolutely. It hit me when you two were going through your intros. I actually did the reverse. I started in state service 30 years ago, spent 10 years, a little over 10 years here in my home state of Illinois, where I still live, working in the child welfare program and the Medicaid program. Spent the last 20 leading national practices, always focused on government as a client, always focused on health and human services. And to your point, Danielle, really sitting kind of at the intersection of policy, data, and technology, and really passionate about cross-programmatic initiatives. So how do we think about more holistically what an individual or family might need and how those needs can be collectively met across our programs and agencies? For the firm, I've been in our national practice in HHS here in the US for almost 4 years officially, and for the last 2 leading our efforts around global human services. So now have the opportunity and honor to work with our teams in 27 different countries doing very similar work. The commonalities are quite massive, and the challenges, quite frankly, that we see in those other countries as well. So it's been amazing to bring stories back and forth. But also, to your point, the personal connection. If you remember, I mentioned I worked inside child welfare and Medicaid. Our youngest child came to us through the foster care system. So then I had the opportunity as a kinship provider to navigate Medicaid and child welfare from the outside in, the programs I had worked inside of. What I found in that experience was not what I anticipated. It was frustrating, it was challenging, it was highly motivating. And I think it represents a great opportunity to continue to keep that perspective at the forefront of the conversations we have, always thinking about the individuals, the children, the families, and the care providers that really benefit from this, and the opportunity to transform, as well as the impact it can have on those doing the really hard work of child welfare every single day.
Yeah, I love that. I always love listening to you tell your story. And for those of you all, she won't brag. Her daughter, her whole family is amazing, but her daughter that she talked about is absolutely amazing and is serving and has served our country as a member of the military of the armed forces. So again, thank you for her service as well.
Thank you.
We are going to talk about transformation. And the topic of today is really, we've called it the incredible journey of child welfare transformation. And when I sat in office, and even when I talk to different states and counties, we talk a lot about this word transformation. And when people hear that word, right, they think of this huge, massive, everything has to be overhauled. What is the old Southern saying? Turn the apple cart upside down. But what we know is that transformation, oftentimes, especially in social services programs, it's really the incremental pieces that take us down the road that get us to the bigger pieces. So as we think about child welfare specifically, Dr. Shropshire, what does transformation in child welfare, what does that look like from your seat?
Yeah, that's a great question. I would say I can share sort of what we have done and seen over the last 10 years. What I'll tell you is, I think the most exciting part of the journey for the last 10 years is being set up for the next 10 years. And I think that's an important part of transformation. Like many jurisdictions in child welfare, 10 years, 12 years ago, we faced significant challenges externally, saying, hey, your system isn't good enough, it needs to be better. And so out of that came a settlement agreement, came a plan for how to reform child welfare as opposed to how to transform it. And so initially, some of the initial things that we had to do were related to ensuring we had an adequate workforce and related to ensuring we had capacity to operate the system as it was. But over time, I do think that some of the efforts to improve really became transformative in the sense that in responding to some of the criticism, we had to do some things like understand how to get data out of these massive data systems in a way that we could actually use it. And so there were, people who had expertise who could do that, but we needed to have data very visible down to a manager, to a supervisor level, so that we could actually see how our work was going, how kids were being impacted by their experience within the child welfare system. And that's not just about having technology solutions, that's also about having a culture that says that looking at process and data matters as it relates to humans that we're trying to serve, and getting to the place where as a culture, we paid attention to different kinds of things than we paid attention to 8 or 10 years ago. And that's been very, very successful for us in improving truly the outcomes for the kids that come into our system, as well as the staff who come into our system, honestly. And so I think now what the initial pieces of reform and then ultimately building some blocks that have helped us transform have done for us, have set us up to go into a future that's less about making the child welfare system incrementally better and more about how do we serve families and kids better, both within the boundaries that in a sense we have, as well as across whether it's different divisions, multiple agencies with community partners, et cetera. And so the questions we ask or the things we're trying to solve they come out of our mind in a different way than they did 10 years ago. And to me, that's the transformation of child welfare, and we've been able to set up the building blocks really for that over this next season. That's been the important journey for us.
Yeah, you talked about a lot of things, and I think it's going to be important for us to hit on a lot of those as we go through today. One of the things that I always said when I first sat down in the commissioner seat was, how are we doing? And I remember my team bringing me a 5-inch notebook full of every piece of data that you could ever imagine, and I'm flipping through it, and I said, but how are we doing? How do we know we've served our families better? And so what we often hear with lots of government agencies is that we are data rich, but information poor.
Right.
And so that's one of the things that as we focus on the future of serving our families, I think you said it great. How do we know that the families are better? Because we've touched them.
Mm-hmm.
Andre, you spend a lot of time talking about data and tech. What does transformation in this space look like to you?
So I think it's interesting, we still operate in a space where we're asking people to show up in person for a lot of things. We're asking for handwritten signatures. We're asking people to fax things. That legitimately happened within the last 5 years in our experience, being asked to fax something. We're looking at a generation coming up that just really, that's not at all the life that they've experienced. They're very used to being able to do things quickly, online, digitally. They're very used to being able to give information about themselves as they deem appropriate for their own purposes and use. And I think we have a lot to do to catch up on that front. It's certainly not data and tech that is the hindrance. I think, Dr. Deb, I'll shortcut that a little bit. Dr. Deb mentioned it a moment ago. It's a mindset shift. It's amazing how in all of the conversations that we have, there's such an appetite for transformation, but it has to start really with beginning to think differently about the purpose of the work, the purpose of the program, the opportunity to use data, the opportunity to implement new technology, and even into the impact that that has on the workforce. We have a lot of very bright minds coming out of college now, very interested in serving in this capacity, working and getting involved in human services, but they're not interested in legitimately a job description that includes a Sharpie marker and talks about redacting paper documents, which unfortunately we still see. So I think the data and tech piece is huge. There's a great opportunity for digitalization across the program, but the workforce impact, the mindset shift, being able to allow people to give consent, the idea that I can say, I'd like you to use the information you have about me for me is another great opportunity, I think, that we'll see more and more of in the coming years.
Yeah, I agree. And as you were speaking, all I could think of is a visual of my 16-year-old son trying to figure out how to fax a document. I think that's going to be my new challenge for today, to figure out if I just go and tell him to fax the document and just watch him stand and scratch his head for the next 15 minutes. What I failed to mention to participants is this is, as you can tell, a very interactive session. So if you have questions or comments, please drop that in the Q&A, because we want to make sure that as we wrap, we give time to those conversations. And if we can address something that particularly sparks you as we're chatting, we want to go ahead and knock those out as they come in. So feel free to use that function and send on in your questions. Ladies, both of you all mentioned a lot about the challenges that we're facing. I know Dr. Shropshire, you mentioned the staff, you mentioned returning to normal operations, budget. Andrea, you mentioned policy and some of the tech and data issues that we're continuing to have. Again, I'll start with you, Dr. Shropshire. What would you say has been your greatest challenge, and how are you currently addressing it or them?
Oh, I think, we could probably all come up with a list of the current challenges, and they may even be different by 5 o'clock tonight than they are right now. But what I think probably our greatest challenge really is probably change fatigue. And that's because we were already in a season of really, again, transforming, adjusting, trying to do something new or differently, building capacity, all of those kinds of things. So we were trying a million new things in foster home recruiting and worker recruiting and supports and permanency and all the different aspects of child welfare. There was already a lot of change. And in this last 3 years, COVID brought such an enormous amount of change to the whole world. So it didn't just bring it to our business, it brought it to our homes, to schools, communities, including community partners who work alongside of us. And so the exhaustion of, I have to do one more thing a different way than I've done it for the last number of years. I've got to learn a new technology so I can fax something, or I have to learn a new technology so I can, whatever it is really challenging to keep people dreaming about innovation or dreaming about transformation when we're just tired. So I actually think that's the biggest challenge. The way that we're addressing that, or trying to address that, I think, is we've just been providing a ton of support, a lot of grace over the last 3 years, especially both in terms of flexibility in the way our staff work. And we're continuing with that. So even though we have, for quite some time now had people back in the office, we've actually continued with quite a lot of work flexibility. For child welfare, I think that works well anyway, because we're trying to match up with birth families and foster families and others who may have unusual work schedules or life schedules that don't match up very well between 8 and 5. And so continuing to provide supports, while at the same time really trying to listen to our staff, around what is it we need to do this what is it you need from us to be able to do the work better, and letting them help drive innovation or transformation, so that there's a little bit more sense of control, instead of that someone else is doing this to me, which was a common challenge, I think, during COVID. So that's what we've kind of been working toward.
In the consulting world, we talk a lot. So it's amazing how quickly I've moved to consultant speak, but in the consulting world, we talk about change management and doing really giving agencies the strength to implement change. And even phrases like change management feel big and overwhelming, but at the heart of that is exactly what you said. It's making sure that we're really listening to that frontline staff and implementing different communication strategies, so that that frontline worker doesn't feel like something is being done to them, but with them. And one of the things that I always find most impactful is when we can show the folks along the way and have their input along the way, so that they can get back to doing the things that they came to do to begin with, really getting back to the heart of the business. Andrea, what would you say are the greatest opportunities as agencies address some of these issues?
Yeah, that could be a very long list. So I'm just going to kind of stick to this theme that we're on right now. I think the opportunity for family preservation, and it's a very easy phrase to say, it's a very difficult change and shift in mindset and program to administer. But the idea that caseworkers have an opportunity, or as much opportunity, to work to preserve a family and have the tools and the opportunities and the funding, the policy changes required to really support that, also tends to shift their job and their day-to-day job experience. That's an opportunity to feel like you were able to intervene earlier, to keep that child in their home with their pillow, as one of my good friends and colleagues says, primary goal, they need to have their pillow. It's just a great opportunity to do that. And I think there's a second piece of this that I hear more and more in the conversations we're having, which is really critically important. That's recognizing the secondary trauma that caseworkers incur when they are walking into situations that sometimes terrible things have happened, or there's an imminent fear that something terrible could happen. And just really recognizing and rethinking the work that they do, giving them opportunities to do some things that are not continually putting them in the position of absorbing, again, that secondary trauma. And unfortunately, for years, it just wasn't acknowledged, it wasn't addressed, and or at least not in widespread ways. I think that's another great thing that's come up in the last 2 to 3 years, is really acknowledging we've got to empower these caseworkers to have somewhere to go with that, and a process to be able to work through that, to keep them engaged, to keep them healthy, and to keep them, willing to continue to do this very challenging work. It's a great opportunity.
We've got some great questions that are coming in, and I do want to tackle those, so keep those coming. And I think as we go into some of these more specific questions, and I'll toss this up to either one of you, one of the things that I am always pushing people on is, but what's the action? The so what? What can I do? So what practical advice do you give to our listeners that are facing some of these same challenges?
I'll jump in, and then Dr. Deb, you can tag in behind too. I think one of the things I would advise is have a longer term vision, but some short term wins. That's really critical. We do a lot of work around strategy and planning, and having a long term vision, a 5 to 10 year strategy, is absolutely critical to know where you're going. But people, to Dr. Deb's earlier point, get tired in the process of continual improvement or continual change. Having those built-in points of victory, sometimes it's the form of a pilot. We're going to do something in this community and realize a different result out of that. Sometimes it's a data pilot. We're going to start with a little bit of a different tact on the data and drive some different action out of that. Maybe it's a bit of a workforce impact activity that's happening. But building into that long-term strategy, actionable, tactical things that happen that are impactful and visible. And the communication, I think, is really a big part of that as well. We have a tendency in government to not say much until we can say everything. And that just really leaves a lot of room for uncertainty, especially inside the agency and in the families and the community broader ecosystem. So I think open communication, and having that just as a core common thread throughout your strategy and action plan is really imperative to success.
That's a great answer, and I'll tag on to that sort of some practical things that we have done that I think you're exactly right about all the things that you said about short-term and about short-term goals and communication. A couple things we did. One, I just stumbled onto, and that was whenever I started serving as the child welfare director. I had felt like the communication wasn't as robust as I wanted it to be. So the very first day, I sent out an email to all our staff. We have about 3,000 staff in child welfare, and just said, hey, here's who I am. And I mean, I knew lots of them from working with people over the years, but I wanted to give a fresh perspective on here's who I am, here's who my family is, whatever, that kind of thing. And I asked a couple of questions of our team about their work, and I got 400 responses. And so then the next week I said, well, I'm still reading your emails, but here's another communication from me. And we just did a weekly, we called it Good Monday Morning, and just did a weekly email with myself back and forth to the staff. I figured out, don't ask a question every week because I can't get through all the responses, but we did from time to time. And then sometimes we just did shout outs or other kinds of things. But in the process of asking the questions and then gathering that feedback, it gave us things to work on, short-term things that people were saying, hey, these are important. And so then we would use that same communication method to report back. This is what you said, and now here's what we're working on as a leadership team to try to support some of these responses that these issues that you brought to us. And even if they didn't work, and we did a dozen things for every 3 or 4 that actually worked, we communicated. We've tried this, it didn't work very well. We tried this other thing, here's what's coming, based on your feedback. And I can't tell you how much traction we got around the things that I might have thought were important, simply because I think people believed that other things that as an executive team we might have looked at and said, well, that's a small thing, but we did it because we got feedback from staff and we acted on it and we responded. I think that allowed us to carry out some of the other, in a sense, bigger, longer term strategies because folks had hope that we were listening to them, that we were trying to solve sort of smaller, more incremental issues, and they were willing to tackle the bigger ones. And so I'm 100% with you that communication, the stuff that works, the stuff that didn't work, or why you weren't able to accomplish it, all has really served us well in getting our whole team of a frame of mind that their voice matters and that we can really solve anything. I believe that about our team. I don't think there's a problem that can come at us that we can't find ways to make a dent in, to solve. And I think our people believe that too. And they believe that their voice matters, and they're very prolific actually in communicating now compared to 3 or 4 years ago. When I stepped into the agency director role in January, I told our communications team, I was like, hey, I've been doing this thing, which I didn't really tell them so much about. I've been doing this thing for 3.5 years. Now I'm the agency director. I kind of feel like we should do it for the whole agency. And I wasn't sure if we would keep it as a full strategy or just kind of do it in an interim transition time. And I'm getting so much feedback now from other divisions, other teams within our agency that we'll keep doing that. But it really was about communication. It was about short-term. Let me listen to you. Let me try to solve the problems that you're bringing, even if they're, like I said, relatively they may seem not as impactful as some giant vision, but we've been able to get some of the big projects done, I think, because of being willing to solve and communicate the smaller things.
Can I one word, Danielle? I don't mean it, but trust. The whole time we were thinking, that's the word that just kept resonating with me. You've built such a community of trust inside your agency and probably with your external stakeholders as well. And trust is probably the greatest currency we have for transformation.
I do think so. I think where we are right now, I think we do have trust there. We don't have as strong a communication strategy as I want. So that's something that we're building right now. And so I would also say to those who are listening, regardless of whatever position you're in, even if you have accomplished a lot of stuff over the this last season, there's always 10 more things that we're looking at, saying, oh, we want that to be better. And so we're open about talking about that too, not just what has worked or what we've been successful, but also where we are not happy with where the outcomes are, where the progress is, where the communication is, and constantly being of a frame of mind to improve. And that's been going back to the transformation question, that's been a very huge transformation in our system over the last 10 years of going from we only tell the good things and then we sort of don't let anybody see the things that are not good to we don't actually care. We just have to get a better outcome. And so we're going to tell you the good and the bad and the ugly because we want you to come along and help us. But I'm not totally satisfied with where we are with our communication with external stakeholders. And so we're building more capacity for that right now because we believe we cannot do this work by ourselves, whether in child welfare or across human services. It absolutely has to be a full-on community effort. And so that's an important piece of what we're going to be spending the next couple of years doing.
So I would always say communicate, and communicate some more. And one of the things as you talk about your communication strategies, not everybody receives communication the same way. Some people like to sit down face to face. Some people want emails. I had some team members tell me that, well, we get too many emails. So we started doing live webinars. And I said, well, we've got too many cases. How do you expect us to do live webinars? Give us a video clip. And so you adjust based on those. But I think the biggest takeaway that I wish that if we could hear nothing else from what you said, it's that feedback loop. Let's talk about at different points of that communication. Let's make sure that we're letting the teams know, both our internal and external partners know what worked and what didn't work and what we implemented and what we didn't, and creating, to Andrea's point, this culture of trust and this environment of transparency, I think allows people to lean in so much further when we're talking about big change management. I'm going to pivot us a bit because we've got a few questions, and one of them is actually very relevant to the conversation we're having right now. Before we get to that, I do have to read this one comment. Love the honesty of Dr. Deb's comment that we need to reform child welfare before we could transform child welfare. And I think that is indeed just a remarkable thought as we think about this particular topic. One of our listeners has asked, can you provide examples of staff, some things that staff asked for that you were able to accomplish, what did and didn't work?
Yeah, I'm happy to share a couple of examples. A big one, and this got us a lot of street cred. I'm just going to tell you, was we had a lot of staff, like many folks are struggling with around the country, with kiddos maybe waiting for mental health supports and maybe sitting in emergency rooms, pediatric emergency rooms or other places waiting for the appropriate kind of mental health resource to open. And so we had staff sitting with those kids in hospitals. And of course, that's quite a lot of time, and it's just difficult work, and it pulls a worker away from the other children and other cases that they're kind of working on. And so there were a couple of things that we did to try to make that better. First of all, in our particular agency, we did not have the ability to, or we had not previously paid for overtime. We would do comp time for staff. We were able to move to actual paid overtime. The comp time was paid out 6 months after, if you didn't use it anyway. Most of our staff were busy doing lots of things. And so moving to overtime was something that was brought up by our staff. So I didn't come up with that idea. They said, hey, we think it'd be better if we had a choice. We want to choose how we're rewarded for those extra hours. And we actually not only put overtime in place, we actually gave them a choice. So every single quarter, our staff get to select how they want to earn extra time if that is something that happens in their natural work. The other thing we did was we started looking for solutions for other people to help us when we were going to need to sit for a time, whether it was at a hospital with a kiddo, whether they were inpatient or wherever they were. And we identified a partner that had the same values as us. That was very important to me, that they cared about kids, that they had our values. And we were able to contract with a couple of providers who could come and give us some assistance in those kind of functions where really it didn't require the expertise of the caseworker, but it was taking a lot of time for the caseworker, and to create a good partnership between our staff and those folks that were coming to do that. And I'm going to tell you again, an enormous amount of positive response from our staff, because they felt like we had listened to what they were dealing with day in and day out, and that we had actually taken some of their suggestions and actually carried them out. and that it was making their work and their lives easier, more doable for them to be able to, to spend their work week accomplishing what they felt like they needed to accomplish.
Let me ask you this. We've got a question in the chat, and I think it's a good one. It's a simple question. You've got a lot of things ahead of you. You've got the big, sort of, I call them the big wish list, if you will. And then you've got the smaller issues that pop up that are sort of low-hanging fruit. How do you prioritize some of everything from those big issues to even those smaller issues? And Lori, I hope that I paraphrased your question appropriately there.
Yeah, that's a great question. And I would say it is always a work in progress. I know for me, my brain is always going back and forth from the sort of big, what do I want to, what are the things that will transform us or the things to accomplish over the next 3 years or whatever it is, and down to but how does it work today? And how can I make today better for my team? Everything from like the immediate folks I may spend my time with all the way to the front line. And I honestly think what helps balance the prioritization of that is doing a couple things. A lot of the day-to-day smaller projects or improvements take priority as I'm listening to people. So as I'm listening to our team, the more I'm hearing feedback that something is a problem, then the more likely I am to say, okay, we need to go tackle this. It's really affecting folks. But I got into child welfare work because I actually thought we could figure out how to prevent child abuse. So that's always the end game. And so I'm always thinking about how do we get there? And that's always operating in my mind, even while we're doing a lot of the day-to-day kind of improvements. That's not a very good answer. I'm sorry for whoever asked that question. That's probably a terrible answer. I actually probably don't exactly know. Somehow it works out. I promise you it has to do with communication, listening, lots of listening to our team, but it also has to do with saying to people, we're trying to get to a really important place where families are strong and child abuse is minimal or absent in our community. And let's not ever forget that that's where we're trying to go and get sort of lost in the day-to-day details. So it's some combination of those two things that are always operating the day, if that makes any sense at all. So my apologies to whoever asked such a great question. I did not give you a very good answer, but
I actually think your answer was perfect because, and Andrea, I'm going to flip it over to you, but I want us to focus here because you really hit it. I think what we would always do, and I wish you all could see the conference room that I'm sitting in, is literally keep an empty chair across the desk. And that represented the families we served. And whatever decision we were making, you look and you think, okay, are we I'm pointing like you all can see me, but right, does that decision benefit that invisible or our hypothetical family, if you will? And if the answer is yes, then let's do it. Is it low effort? Is it high effort? How can we fit it in the competing priorities? And at the biggest part of the day, I think it's important for us to acknowledge, and I want us to spend some time on this in just a second, there's still the day-to-day. And you talked about this, Dr. Shropshire. There's still the flurry of the day-to-day. So how do we focus on that? But we're going to talk about that in just a minute. Andrea, you were going to chime in on this.
Yeah, and this is going to sound very consultancy, but I'm going to go back to my time as a decade as a state employee. We did a great job of managing priorities in the moment, in the fire, the thing that would come down from the legislative body with an unreasonable time frame. Sorry to all the legislators listening, but it always was an unreasonable time frame. But we didn't do a very good job inside of our own agency of really having literally written down everything that we were working on, the expected timelines, and understanding when we said yes to this new priority, what was that actually pushing out? Because at the end of the day, there is only so much capacity in every single agency. and being able to understand everything that you're facing, all of the things that are underway, all the projects that are happening. There's a lot of consultancy words, portfolio management, project management, but literally having things written down and then being able to, again, back to communication, articulate that plan and see how those things fit together. That grand dream that Dr. Deb's articulating, every one of these little day-to-day priorities, little projects, little initiatives, little pilots lends itself into that bigger vision at some point in time. But if it's not written down, it becomes really challenging to manage through. And again, to just understand, if we want to say yes to this today, that means we're saying no to or pushing something else out. And it's important from an overall management standpoint, I think, to just know what that is. Sometimes that's still the decision that gets made, but seeing that, having that management discipline, I think can really be effective.
I want to add on to that too. I cannot speak enough the value of getting people who are passionate about something, and that something is something that you need. It's in the direction of the big vision, into the right seat. And then figuring out how to equip them with some resources or with some, whatever it is they need, some attention, sometimes it was some communication, like spreading the word. It was a lot of different things. It wasn't always money and it wasn't always FTE, although sometimes that's what it was necessary. And then kind of like giving that a little shove and letting it go and going on and finding the next person, the next person, the next person. If you get people in the right chair who are really passionate about something, and they know where you're trying to go, they will go so much further than you could ever line up on I could ever line up on a to-do list or a prioritization list. And I've been amazed at some of the folks that I've encountered and said, oh gosh, like this thing you're trying to do, it's in the direction we're trying to go to help strengthen families. How can I help you? How can I resource you? And then I'll kind of come back around in a few months and I'll think they have gone way farther than they ever would have if I was having to keep up with the to-do list. And so getting folks who are passionate, who understand where you're trying to go in the right spot, which is easier said than done in government, because we tend to have a few job descriptions and they look like a box and you need to fit in the box. I think we have to figure out how to break within. Now there's probably HR managers on the call who are breaking out in a cold sweat. I don't mean to mess up the HR system. I'm just saying within what we have the ability to control, we have to get people into spaces where the work that they do every single day is something they really love and they really care about. And there's plenty of different opportunities across child welfare systems for people with different kinds of passions. And if you can, the more you can do that, the more you'll get done without actually having to communicate a whole bunch of priorities. People will just do it.
So one, I am an old HR lawyer, so no worries. I didn't shudder at that. But I think it's important to pull together both of the points that you all made. One, it's the communication, it's putting the people in the right spots, but then it's also having this greater, it's almost like a strategic roadmap, if you will. And I know that does sound like this big thing that sits on a shelf, but it's the North Star. It's pointing people to the direction that we want to go and helping people understand each one of those, what the different points along the way and how they are leading into that greater vision, I think is always so very, very critical. We're getting a lot of chatter about workforce. So let's flip to workforce, because we well know that our child welfare workforce is, like everyone else in the world of COVID, has really just been tossed on its head. We also know that transformation requires understanding the pain points from some of the frontline staff. We talked about that so that they can more effectively perform their core mission. We hear about recruiting and retention. What tools have you found, or Andrea, in the space of different people across the globe, what has been most effective in motivating and supporting your teams?
Yeah, that's a great question. And I have to tell you what has been the most consistent answer globally. It's not money. Not that money doesn't help, but money and increasing wages alone is not enough to resolve this issue. So, I think that's where in the beginning, we saw everybody start is we'll just give people raises and they'll stay, they'll be happy at that point. Where we've now, I think over the last 3 or 4 years evolved to is we've got to reimagine the work. And that goes back to your word reform. What is the work of child welfare of that agency? And how do we let those who are day-to-day hands-on doing the work have a voice in what that new definition of work looks like? If that work changes, and sometimes that's automation, sometimes it's responsibilities. Deb, I love or Dr. Deb, sorry, the example that you gave of pulling in community partners to do things that don't require caseworker acumen or licensing. That's one of the things that we talk a lot about in our healthcare practice as well, is getting practitioners to work at the top of their license. So taking that second look at the work and who really needs to have what level of licensure to do X, Y, and Z. But again, I think that becomes pretty big pretty quickly. So you have to pull that back down. Okay, this is where we're headed, but practically and tactically, maybe we start with this unit. Maybe we start with this particular part of our process. Maybe we start with this particular responsibility and we think about the work differently and then bring it all out from there. It's a continuing conversation. It is in child welfare, but it's also in the other human services spaces. Housing and other assistance programs are struggling in the same way. And even our clients in the private sector, very much rethinking what is the actual work that needs to be done, not just what we've always done, but what's the actual work that needs to be done. And then how do we digitize that where possible? Let's let those things that can be automated and redefine the real work that we want individuals doing and the roles and responsibilities necessary to support that.
Yeah, I would agree with you 100%. One of my goals is to try to get our staff, our frontline staff, as much ability to spend face time with clients, whether it's kids or parents or foster parents, whoever it is, and less time doing documentation. Less time. In the past, it was shuffling papers. Now it's digital, but it's still a lot of data entry and things like that. And so that's certainly that we'll continue to say what improvements help us increase our face time with humans and decrease our time literally just being sort of data entry folks. A second thing we've done is we had to team in different ways, new ways, and try all kinds of things at the early days of COVID because nobody knew what was safe to do. Nobody knew. We didn't have, back, you guys remember nobody had face masks. We didn't even know we were supposed to wear a face mask, right? There wasn't PPE and all of those kinds of things. And so in those early days, we tried a lot of different stuff. We had a small handful of staff that went out and, for example, initiated child welfare investigations, and then they handed back information to a second person who was maybe working from home who finished out cases. Well, those things were successful in the early days of COVID. And so as we've kind of encountered some of the workforce challenges, one of the things we've done is gone back to some of those what we would have thought of as temporary innovations because of this pandemic, and said, well, are there things from that we learned that we want to actually incorporate into regular practice? And so we're using playing with the idea of some work from home teams that give our caseworkers a chance to take a break when there has been some secondary trauma. So you think about, you were talking about secondary trauma earlier. If I've been out in the field a while and man, I really need a little bit of a break from that, are there jobs that we can, or spaces that we can team workers with other workers, field workers, and give folks a little bit of rest, and at the same time take the load off those who are kind of out on the front lines. So we're playing with a lot of different teaming ideas, a lot of different, how do we equip our staff with options for helping them with some of that data entry. So everything from dictation capacity to tools that they can use in a mobile format instead of having to be at home or in the office or whatever, so that they can choose. What my goal is, everybody doesn't do things the same way. Some people will be okay dictating. Some people will not want to talk to something like that. They'll want to write, or they'll want to type, or whatever it is. And so what are the different assortment of tools I can give to a worker to make it easier for them to do some of those required parts of their job, so that I can free them up for the things that they do that actually matter. Because a lot of stuff we do that's required, I think our staff would say that's not what makes a difference to a kid or a family. And I want to minimize the stuff that they are saying isn't really impacting a kid or a family.
And that is dead on. And in fact, one of the questions in the chat that I just want to call out because you answered it is speaking to approaches to support frontline staff and being more family centered in their day-to-day work. And that was exactly what you hit on. And I think that allows us to get back to the purpose of why we do what we do. I know that we only have 10 minutes left, and I have a lot more questions in here. So one of the questions that came in is from Jennifer, and she says, providing the option of overtime versus comp time is a great benefit to the employees. You were speaking of this earlier, but how is the actual retention of workers, and how do you recruit new staff?
Yeah. So yeah, recruitment and retention is, it was a challenge before COVID. It has not gotten easier. We did in the early, maybe 2020, 2021, we did see our turnover go down significantly for a season. But then once all of the workforce started moving again, we didn't. And Oklahoma actually has a very low unemployment rate. There's a lot of people looking to hire. So we have a lot of competition. And not all just competition across human services. I mean, you start looking at hourly salaries or things like that. We have competitors that are bunch of other sectors than maybe we would have had in the past. So it's challenging. We've done a variety of different kinds of recruitment and retention incentives. One of the things that I thought we did that was actually really, well, I think it was smart. I guess you guys can decide if you think it was smart, but we knew that we probably had people who stepped away from our agency in the early days of COVID because of illness, family issues, kids being home from daycare or school because of those things being closed, et cetera, who maybe they were just tired, burned out, that stepped away, but maybe they still do really love child welfare work. And now they've had some time away. Maybe now life has settled down. And so I said to our team, why don't we go back and get our friends who left? Like, let's go get them first, because they can step right back into a field they already are familiar with. They don't have to be retrained for the most part. They may be able to step right back into a caseload, which gives our existing staff immediate relief. So we did a bonus recruitment incentive to go recruit people who had left child welfare in the last few years and bring those folks back on. And the incentive was for not only the employee coming back into our team, but also the team members who went and found those folks. We also said, if you guys will support each other and both be here in a year, we'll pay you both a retention bonus, because we were trying to build some natural staff supports between staff members who already kind of identified themselves as having a relationship or a friendship. And that actually was pretty successful for us for a season until we kind of got all those folks back into the fold. So that has been something that's worked for us over this last couple of years.
All right, clock is ticking. I've got one question for each of you left. I'm going to flip it to Andrea, and then I'm going to close with Dr. Deb, and we'll keep monitoring the chat. But Andrea, to you, technology, we talked about just briefly, it continues to have this increasing importance. We've talked about this over and over, especially post-pandemic, or I guess that's where we are. Many agencies are moving to new systems that will really help them better enable themselves to serve children, including tracking and monitoring, financial reporting, financial management, all of the federal reporting. What advice do you have to agencies, or what have you seen that has been particularly successful as you have witnessed these larger technical transformations in child welfare?
That's a great question. I wish that there were a shining example of just go follow the pattern set here and everything will be fine. I think the systems implementation side still has its challenges. And part of that has to do with the fact that the work and the way the systems are designed is still very programmatically focused, very much from the administration of a program standpoint, where we feel the pressure, and the things we're talking about today are really reforming, transforming, changing the work, changing the workforce, and changing what the workforce does as it interacts with the system. So I think we're going to see a little bit of continued challenge as we bring those new systems up. I love the idea, and I think there's more and more of an appetite for this. If you have contractually the flexibility to leave that system sit for a minute, and we've seen the opportunity through ACF to do this, and you can think about some kind of shorter term improvements, right? That's back to that theme. There's an opportunity to leave that repository, that transaction-based system in place, and actually start to improve around it. So thinking more about the strategy, what do you actually need? What do you need that you don't have today? What do you need access to? What kind of information do you want to generate outside of that system? And is there a way that you can get that with that system, without the 10-year roadmap to a huge transformation? There are some incremental improvement opportunities. Again, we're seeing more and more of that, not just in child welfare, but across some of the other programs as well. And that's an ongoing conversation. So just, quick pitch, I'll speak for Danielle and Dr. Deb and I. Connect with us on LinkedIn. This conversation is going to continue. If you've got an example, something you think is innovative, I know the three of us would love to hear about it. And I think there's just a lot to continue to watch change. What used to work is not working, and everybody knows that. So we're seeing some states that are starting to step out and try some different things, and it's pretty exciting.
Yeah, I love that. Dr. Deb, Oklahoma has been in the midst of a few incremental changes over the last few years and has been recently granted some good news. I wanted us to close on good news.
We have, and I'm always like, there's good news, but we have 5 more things that we're going to fix. But yeah, the good news, I think, from Oklahoma is we had been, as I mentioned earlier, part of a lawsuit and a subsequent settlement agreement around our child welfare system. And in about a 10-year period of time, really only about 8 years of being graded, about 10 years of work, really have been able to exit about 75% of that lawsuit as of a week or so ago. So that's pretty great. I think what is better is not just getting to a point of exit as if it's a finish line, but actually that we have about 763 staff that have been here in child welfare since the beginning. So I asked them, what are your reflections on how the system was 10 years ago compared to how it is now? And the stories I got from our team about the difference, and they weren't just talking about what it's like to work here. They were talking about what they believe the impacts are for families, for kids, for outcomes. The difference in where we are now compared to 10 years ago was really, really powerful to hear through their voices. And we're going to continue to gather those stories from our team, because I think that's really where, where we have an opportunity to kind of stop and say, man, this system really is different than it was. And then I'm going to push them. I'm already starting to push them to say, and where should it be in 10 years? Like, let's start to dream. We didn't think we could be at the place we are today 10 years ago. Nobody would have imagined we wouldn't have shelters, state operated shelters the way that we did at that time, that we would have had completely different outcomes for kids, for example, who were legally free, but not in an identified placement. There's a number of places like that where we can name the kids who were directly affected by these improvements. Now, what do we want it to look like for 10 years from now? And I think what a lot of the answers are going to be is we want kids to have not ever had to be in foster care in the first place. How could we have wrapped services around families in different ways, around relatives in different ways that allowed us to not be a foster care system, but actually allows us to be upstream. And so anyway, it's really good news for us in Oklahoma. So thank you for asking.
That is awe-inspiring and definitively a way for us to conclude. There are still questions in the chat. This conversation is not over. It is over for today, but I want, as Andrea mentioned, go out, connect with us on LinkedIn. Let's continue this conversation virtually, because what we know is that if we're all leaned in together, there is no wrong answer, and that our families will be better off. I will say personally, I am inspired. I feel ready to, this is the best conversation I've had all week. And I thank you, both of you ladies, for being very vulnerable and being very honest about how we can continue to make transformative change inside of our child welfare systems for the betterment of our families. So thank you both. And Meg, I'll turn it back over to you.
Thank you, Danielle. And what a fantastic conversation. I saw in the chat that it was inspiring, and it absolutely was. So Appreciation to today's speakers. Thank you, Danielle, for moderating that incredible conversation. Dr. Deb, so great as always to see you, and shout out to Dr. Deb as a member of NAPWest. We very appreciate your leadership. And of course, thank you, Andrea, as well, for a great conversation. That is the conclusion of today's content. This webinar was recorded and will be sent out to all those registered. We appreciate your time and thank you for joining us for this conversation. We look forward to continuing that conversation, as Danielle said, on LinkedIn, and feel free to reach out to both APHSA or today's speakers for more information. Thank you so much. Have a great rest of your day.